What's up?
What's up, Doc? How you doing?
I'm good.
You know you have to start because I be not know how to do it.
I was waiting on you to start it. I was like, oh man, she up there.
No teenagers out here to help me. No teenagers out here to help me today. Home alone, so the struggle is real.
I figured you were on the struggle bus over there.
I'm gonna get it. If I don't learn nothing else, I'm gonna learn how to use social media.
You got it.
I'm gonna get it together.
You've been doing all right with the little like stories and stuff. I've been impressed.
See, I'm good at that because it's pressing buttons and typing stuff in. But when it comes to auto stuff, like I be struggling.
Got it.
And
you get better.
I didn't wean down TikTok, so if it ain't one shot, it's gonna take me a whole day.
All right, we here, so let's get it started. All right, so this is going back into our question series. So she came to my office and we had our second post op visit, right?
Yeah. So basically, I'm probably a little over 2 months post op. I want to say maybe 10 weeks, give or take, or 11, 9 or 10 weeks.
So now we got questions.
Yeah.
So hopefully I got answers.
What? You're not sharing no hospital ice? That's like one of the best things ever. The only reason a trip to the hospital is worth it.
The hospital ice. I'll be dehydrated. I'll be too much going on. What's our first question?
For those of y'all joining, if you haven't seen my journey or you haven't seen my whole live, I am one of Dr. P's patients. I had advanced fibroid disease. I worked with him to get over many of my fears of having surgery. And I had a hysterectomy back in September. I am, like we said, about 10 weeks post-op. I am doing wonderful. I have to thank everybody on social media for all of the support, all the love, all the DMs. People send me questions. Most of the support, we get a couple trollers here and there, but everybody has been so supportive of my journey. It definitely helped me get through this. And I am definitely a living testimony of the only reason I didn't do it sooner is because it was supposed to be Dr. P. Because my life has changed a whole lot in 10 weeks. So our last live,
and we want to prevent, because when she say advance, she means advance.
You just gonna ride me on that
all day. So advance means 5 pounds 7 ounces. We want to get y'all to a point where you come to see me before we get to that stage of advance. She is queen of advance. We want the underlings of advance. So if we can educate and prevent it from getting to that point, then that's the whole point of this. Let's open it up for questions.
So yeah, I am an extreme case. But since the last live, I've still been getting questions. People really gave a lot of positive feedback to us doing this together. So to pay it forward, I appreciate Dr. P. So I will I'm gonna try to give you guys a chance to visit my doctor with me as well. So question number 1, and I get this a whole lot, is questions about endometriosis. So
I can't see the questions. I don't know what.
Yeah, I'm gonna give you the ones that were submitted already, and then we'll go to the ones that.
Because I can't see the people that usually they pop up on the bottom, and I see questions. I don't know what this one is about. They always doing something with it. Turn off request. No, it's on there, but that's fine. Okay, hopefully it'll start popping up. But let's go ahead.
Okay. I see names. I don't see questions in here yet.
I don't even see names. It just says we're trying out a simpler version of live and temporarily turned off a few features. I'm just like, I don't know what that is.
Oh, you know what? Instagram have like an automatic filter on. I'm gonna have to show you. See, I do know a little bit. I'm gonna have to show you to change your settings to allow everything.
Huh.
They did some type of upgrade, so I'll show you that later.
All right. Well, then you're gonna have to answer the question because I don't see it.
Okay. So let's go with number one.
Okay. Endometriosis.
Yes. So
what was it?
The question is, can you still get endometriosis after a hysterectomy? And if so, how would it be treated?
Excellent question. So let's start off with talking about what endometriosis is, right? So the lining of the uterus is called the endometrium. And when that lining of the uterus grows anywhere else but in the lining of the uterus, that's what endometriosis is. So the theory is that the endometriosis is caused by retrograde menstruation, meaning like, you have your period, and instead of your period going down, it kind of will block back up. And some of those cells and those tissues can go through the fallopian tube and can kind of implant into your actual abdomen and pelvis. Well, the problem with it is that number one, it is the endometriosis is fueled by the ovaries, right? So when you have these lesions that are on the inside of your belly and your pelvis, they are responsive to the hormones that your ovaries produce. And so when you have periods and when you don't have periods, those hormones are still being produced, and that's what can cause pain. It's almost like having a period in other places of your body other than your uterus, right? With that being said, when you remove your uterus, you don't remove those implants. Those implants still remain, right? So removing your uterus in of itself does not get rid of endometriosis. Since endometriosis is fueled by the ovaries, in cases of patients that have horrible endometriosis, the only answer, well, not the only answer, the final and definitive answer will be to actually remove the ovaries. However, there are many treatments for endometriosis, many medications. There are also the surgeries that you can do to treat endometriosis without a hysterectomy, but realize that it's still there. As long as you are producing hormones with your ovaries, endometriosis can still be a problem. So in a nutshell, in answer to that question, if you remove your uterus and you keep your ovaries and you have a horrible history of endometriosis, then yes, you will still have endometriosis. You will have to undergo hormone suppression the same way you would if you didn't have a uterus to actually treat it.
All right. Next one. So should you follow a specific diet after fibroid surgery? For example, all organic, no meat, grass-fed meats, no dairy, etc., etc.
You should follow a diet whether you have a hysterectomy or not, right? So people wait for, these events before you want to start eating healthy and before you want to start dieting and exercising or what have you. We're not waiting for hysterectomies. We're not waiting for, you to be diagnosed with big fibroids. We're not waiting for those things to eat healthy and to live healthy lifestyles, because the most important thing is our overall health, which consists of our heart, our lungs, our liver, our brain, all of our other organs really thrive and depend off of us eating appropriately and exercising as well. There are a lot of myths that are surrounded about where fibroids come from. And as I've always said, we don't know. We studied and studied, but we still don't know where fibroids actually come from. With that being said, I have people that say, well, I stopped eating meat, or I stopped eating dairy, or I stopped eating whatever you want to stop eating. There's been no data, no statistical evidence that shows that stopping those things are going to stop the growth or you acquiring fibroids. So perfect example. I operate on vegans. I operate on vegetarians. I operate on people that love meat. I operate on people that eat dairy. Every diet paleo, what you name the diet, I have a patient that I've operated on with fibroids for. So, it's just when we don't know something, we always want to say, all right, this is what causes it. But the truth is, we don't know what causes it. And I'll have people all the time to say, well, what's a holistic way to fix a fibroid, or what can I cut out of my diet? I promise you, if there was a study out there, or if there was some proof that it actually, that doing X would, take care of fibroids, I promise you I would give it to you. I'm not out here just trying to operate on people. I just had a consultation with a lady that just was told that she needed a hysterectomy. She consulted me, and I told her she doesn't. Like, she just doesn't. Fibroids weren't giving her problems. I told her, you don't need surgery. I don't want to operate on you if you don't need surgery. So that's another misconception. But with all that being said, you're not, being on top of your health and being a healthy individual and doing healthy things is something that you need to do for life anyway. It's not so much going to just stop the fibroids from growing, but it's something that you need to do.
Okay. All right. Why do you bleed so heavy when you have fibroids? Do the fibroids bleed too? And what makes those clots?
That's an excellent question. So the problem with fibroids typically is size and location, right? Usually large fibroids are so large that they push into the cavity of the uterus. Same way with even smaller fibroids that are located and are pushing into the cavity of the uterus. Fibroids are typically problematic when they disrupt the normal architecture of the uterus, right? And so usually when they're pushing into where you normally bleed from, that's when they cause you to have even more excessive bleeding. That's not always the case, but usually that's what I find. It's usually when the fibroids are pushing into the cavity of the uterus. So it's not so much the fibroid in of itself bleeding, but it's where the fibroid is located to where it's disrupting the part of the uterus that's bleeding in of itself. So that's the big point to that. And your second part of your question, what you said?
What makes the clots? And I know you did post a video similar.
Yeah, I just posted a video on that. So I'll repeat it though, okay? So clots are simply pooled blood, right? That's all it is. So when you have your period, it doesn't just all gush out in one big puddle, right? Your cervix has a really, really small hole. It's a long tube with a really small hole. So you got this big puddle of fluid or blood that's trying to get out of this. It's like, I'll give you a perfect example. It's like if you're taking a bath and then you take the stopper off and you expect all of this tub of water to get out of that hole in 5 minutes. It's not going to happen. All right. So the thing with blood is if it sits for too long, it clots, right? So you can have multitudes of different things. You can have a lot of bleeding and you don't have a very large opening for your cervix for it to get out very quickly, or you could be in like a sedentary position. Like you can be asleep and have your menstrual cycle, right? And you're laying down and you don't have the benefit of gravity helping you. Or you could be sitting in a car, you could be traveling and the blood is just pooled there. So if that happens, clots form. All right. So like I was saying, like clots are really not the worrisome part. The worrisome part is if you're having excessive, exsanguinating, bright red blood just coming out, pouring out. That is a problem, right? When that is excessive, then you can get anemic and that's problematic. And that means your blood doesn't even have time to clot, right? You want your blood to clot. If it doesn't have time to clot because you just consistently bleeding, that is of concern. The actual clotting is not of concern. I mean, it is of concern because if you have these big, large, massive clots and they just keep coming out and it's 10 days, 12 days, 14 days, and you just accumulating all of this blood and clots and just clots and just clots. At a certain point, yes, if you are excessive with it, yes, it's a problem. But in the short, it's not. Like if you have clots with your bleeding and it's controlled, it's not such a big problem. But the other misconception about clots is, clot, when you hear clots, you automatically think of bad things. Like, clots are not created equal. You have clots that are external or that are coming out of your body, meaning that things that you've already bled and then they clot, and it's internal clots. Internal clots are the problem. So just like blood can pool into your uterus, blood can also pool and clot in your vessels, like your veins and arteries. That is a huge problem, because if you have pooled blood in your uterus, it's going to expel out into the atmosphere. Fine. When you have a pooled blood that's in your artery, like let's say for instance your artery in your neck, your carotid artery, that clot is going to break off and is going to shoot up to your brain and cut off the blood vessels in your brain. That's how strokes. That's one of the things for a ischemic stroke. Like if you have a clot that comes up and it breaks off and it goes into the smaller and smaller vessels, it's almost like having a big piece of tissue, and then your vessels get smaller, smaller, smaller. Well, as it goes, it gets trapped into the smaller pieces of tissue, and none of the blood behind it can go through. That will cause a stroke, because you can't have blood go to the rest of your tissues. Big problem. Or when you hear something like a pulmonary embolism, where you have a blood that clots in your veins and your legs just from sitting and pooling, that clot can break off, and that'll go to your lung. Right? You go to your lung and you have a clot in your lung. Now you can't breathe. You can't oxygenate yourself. People die from internal clots, which is totally different from external clots, which are, the clots that can happen in your uterus and get expelled out. Those are not going to kill you unless it's just super, super excessive.
All right. We got a question in the video. So, do you recommend pelvic floor therapy after a hysterectomy? Pros and cons of doing such therapy?
I recommend pelvic floor therapy when you need pelvic floor physical therapy. So situations in which you would need it, if you're having pain with intercourse, sometimes women will have certain prolapse issues, certain incontinence issues can be helped and remedied with pelvic floor physical therapy. I would not knee-jerk say that women need to have pelvic floor physical therapy after hysterectomy, because most of the time, it's perfectly fine after. Use pelvic floor physical therapy if issues start to arise.
Okay.
And this little thing at the bottom is really bothering me.
Hold on. So some people send messages to me as well. So some come in the chat, and that's why I got two phones going. Next one. Okay. How do fibroids become calcified, and does that change treating them?
It doesn't change treating. I mean, they just do that. Fibroids have different characteristics. Sometimes they can become calcified, and there's no rhyme or reason for why some ones will become calcified versus not. But yeah, it does kind of impact the treatment, unfortunately. Like if you have a very, very calcified fibroid, it may be difficult to do, treatments like an accessor. Even though I haven't ran up against, a fibroid that's so calcified that I haven't been able to perform accessor. But things like, uterine artery embolization, which I already told you all I'm not a fan of, but that makes it more difficult when you have uterine artery embolization, when you have calcified fibroids. They're a little bit more painful as well, because those fibroids are even more rigid. They're more hard. And that firmness is what causes the problems. It causes bulk symptoms where, you can have pain with sex. You could have, decrease. If it pushes on your bladder, you may have decreased ability to, hold your bladder. You may pee more frequently. It may push on things and cause pain. It can cause you to have painful cramping, right? Because your uterus is cramping around a very hard object. So those are some of the things that calcified fibroids can do. As far as treatment is concerned, they're not more difficult to remove. When you do a hysterectomy, it's a little bit more difficult because, like, if you have to do a myomectomy to get it out of the vagina, it becomes a little bit more difficult. But overall, it's not. They can cause you to be more symptomatic, but not as hard to treat, if you will. And was it another part of that? Did I answer that?
No, it just that was basically it. How does it get calcified? And you said they have different characteristics, so they're not all created equal. And then does it change treating them?
No, it doesn't. It just it doesn't change treating them. Sometimes it's just a little bit more difficult to treat them if they're calcified. But as far as going back to if you have a particular diet or something or whatever, if you're thinking that might lead to the calcification of fibroids, that's not the case. Like, if it's going to get calcified, it's going to get calcified. It's not from you having more calcium in your diet or something that you're eating or doing. That doesn't impact it.
Yeah, I think that might be what they were asking.
Got it. That's probably
more. What is sex like for a man and a woman after a hysterectomy?
Sex like for a man and a woman. Sex for a man is the same. Well, I'll take that back. Sex for most men is the same because most men have no idea. All they feel is vagina anyway. If they feel that little knob back there, which is your cervix, then if they're long enough to reach back there, one, and two, if they know what they actually feeling, it may be, they may not feel that knob, but it doesn't change the sensation of the vagina. Like, it doesn't make anything different per se for a man. As far as a woman is concerned, I've done this surgery on a multitude of women, right? I have not heard anyone come back yet and say they were unable to have orgasms or sex was completely different after they had the hysterectomy. If anything, it's been more pleasurable for most women, right? Because usually when they have fibroids or something like that, if they're big enough and they're pushing out into the vagina, it causes pain during sex. So now once you remove it, they actually have more pleasurable sex, and it's not impeding like orgasms or lubrication or any of those things that mythically people run away from hysterectomies thinking that it's going to just completely destroy their sex life. It's not the case. Like I said, I've seen enough women to be able to firmly make that declaration that sex for men and women, if anything, will improve after a hysterectomy as opposed to get worse.
All right. So I think this question is for me because they're saying, what were some complications from as a patient you experienced? So I guess this is a layered question because
you could tell them.
Okay. So, well, first of all surgeries have risk. So I think sometimes when people ask me this, they want to know, is there anything that happened to me that would make me say, don't do it? Absolutely not. You just need to do your research and find somebody you can trust, because the complications I had, I'm asleep. So if you watch your first live, I lost a whole lot of blood. I'm asleep. I don't know that's going on, but I trust my doctor to make sure if something like that happens, he's going to take care of me or make sure I get the transfusions I need. Another complication I was told, but again, I'm asleep, is that my surgery was a lot longer than most hysterectomies. So Dr. P, if you watch the first live, admitted that he was doing Tyson Fury on me. And I guess they say hysterectomies could be 3 to 4 hours. Mine was like maybe 6.5 or something like that. So again, you have to make sure you trust your surgeon, because the anesthesiologist told me nobody else has your operating room today. So I didn't have to worry that Dr. P was going to treat me like an assembly line and get me in, get me out, get on to the next case. And also, I saw my insurance bill, so he doesn't get paid for the extra 2.5 hours that he put. As a matter of fact, I saw how much they say, well, this is what we think we should pay you for what you did versus how much it should really cost. Like, you see all of that when you get your bill. So you really have to do your research and make sure you can be comfortable with who's going to do it, because I do get a lot of messages and inboxes from women that have had post-op complications. That didn't happen in my case, and as we said, mine was extreme. I did get a couple more bruises than we anticipated, Dr. Johnson. I had a little bit more. I had a little bit more bruising from the movement or the jerking me around than I expected, but nothing that's not healing, fading away. I'm putting my vitamin E oil on it. I'm just not gonna be on OnlyFans for 2 weeks. No, but I did have a little bit more bruising, and right now I'm not a Sports Illustrated model, so I'm good. I mean, I don't have anything. Like I said, the only thing that I can tell you is that I wish I would have did it sooner, because these 10 weeks have been like just amazing. And but like I said, it just was supposed to be Dr. P, because I was really nervous. If you watch my journey, I probably dealt with fibroids for 5 to 6 years before I had my surgery. So I was dealing with symptoms every month from them. And I finally just had a breaking point and was like, I really have to do something. So, and I was like right that close to being over the non-invasive surgery limit. So I don't have any.
Oh, you was over. You
hesitate.
You was well over that point. I was just, man. I just said, forget it. Like I'm gonna do it for you. But God,
right.
It was tough,
but yeah, so I think that's what people ask me, because I get that a lot. Like, was there any complications? And I just have to say, I was very fortunate. I really don't have any. I really don't have any things that I could say you shouldn't do it because you're going to go through this or you're going to go through that. Everybody is different. Everybody's surgery is going to be different. But trust your provider, ask the right questions, and advocate for yourself.
Absolutely. Couldn't say it no better.
All right.
The young man asked me about advice I would give to upcoming medical students. Just DM me. We could definitely talk. I give advice to you guys all the time. So just DM me about that.
All right. Next one is, and I think this one is for me too. What do your scars feel and look like? Okay, so my scars are just as small as they were the day, if you watch any of the videos, the little circles on my stomach. I could show. Let me move the camera back. If I wear high-waist clothes, you can't see anything. So, and I don't know if you can't see anything if I have on something high-waist. If I bring it down some, I still have those little circles. So they're smooth, they're flat. I guess they'll fade. I'm sure.
No, they will. So the total healing time for scars is about 9 months. So what will happen is those scars, they'll feel lumpy at first because there's scar tissue up underneath it, so they'll feel kind of hard and indurated. Then they'll turn dark. They'll be darker than, or pigmented, just like a scab. So they'll be pigmented at first, and then they'll go to light, right? So then they'll be a little bit lighter than the skin. And then the final phase is they'll start to flatten out even more, and then they will become the same complexion as the rest of your skin. So where there's a very, very faint line that you'll see. Most people that would see her would not even know she had surgery. If you see it, you just, people that know what surgery looks like would tell a little bit. But at the end of the day, not going to really tell like these scars. These scars, you be able to, maneuver regularly without, having to look at bad looking scars. So she'll follow up in 9 months and you'll see that they're pretty much gone.
All right.
I really hate not seeing my questions though.
I know. I can't see. I can't see any more questions, and I can't see certain ones. Like I couldn't see the gentleman's question. I told you, Instagram been doing all types of weird stuff.
I don't know why they're doing that. They're always doing something.
They make it harder for people who have want to get information out, I guess, or they decide what content people get to see.
I guess. Well, I guess if you got questions and they not answered during the live, then I guess just put them in the comment section when we post it, and I'll try to answer them. Because I can't see anymore.
Yeah, and I definitely, I'm a little bit social media handicapped sometimes. I'm good with posting, but sometimes messaging I get to later. So please do not think I'm ignoring you. Sometimes I'm not. Like I said, you follow Dr. P, but not me. So it goes to a filtered message. And as soon as I get through all the Bitcoin people, I see you guys. So I'm getting there. I'm getting there on all the fake page type stuff. But I do try to read your messages. I do try to keep these lists going. When it gets to so many, have people ask me the same thing, I put it down, and then I reach out to Dr. P and say, hey, it's time for another doctor visit. This one on me. So
it works.
And like I said, that's just to pay it forward, because I probably wouldn't have got through it without all the support, and definitely not without the trust that I had in my provider. So, but yeah.
What else you got? You got any other ones?
Yeah, I just got a ding. Hold on. Is there an association with bleeding and perimenopause? Heavy bleeding and perimenopause?
That's a good question. So, yes, there can be. So, perimenopause is just first and foremost, every woman is going to experience menopause at some time. So menopause is the failing of your ovaries. It is when you stop periods for 12 months without any other associated factors, whether that be pregnancy, whether that be medications. When you're of age, greater than 40, and you have a cessation in your cycles for a year or more, then that is menopause. It's going to happen to every woman. It's every single one. No matter who you are, it's going to happen. With that being said, when you have failing ovaries and your ovaries are not producing the hormones that they're supposed to, you don't ovulate regularly, number one. And then number two, your body is kind of confused because it's used to having this cyclical function of ovulation, building up a menstrual, building up the lining of the uterus, and then sloughing off when pregnancy doesn't happen. It does that every single month. When those things don't happen, it can start building up the lining. The lining becomes irregular. You don't have enough progesterone in the body. It starts breaking. It starts bleeding at odd times. You're not having cyclical bleeding because you're not ovulating and you don't have any. You're not going to get pregnant. That can happen. I have women that have excessive bleeding. I have a woman right now, that's in her early 50s that's here because she has severe anemia, and it's from exsanguination of blood that's heavier than any regular period. She's severely anemic, and I see this a lot. Everybody does not experience that, but if you are 40, you're greater than 40, or even in your late 30s, and you start to have excessive bleeding, meaning your periods are either extremely long and heavy, or you're having multiple periods a month, and you're bleeding multiple times in a month, and it's not just 1 month, it's multiple months, 2, 3, 4, 5 months, where you're having multiple bleeding episodes or super heavy bleeding. Yes, this most absolutely could be a indicator that menopause is happening, and that you may need to see help about it, because a lot of women can get through it and don't have to get treated or have any issues, but some women are going to bleed so heavy, and when they're in perimenopause, they have to have something done about it. With that also said, when you are, two things could be possible at the same time. And I see this all the time. That's that, a woman will go in, 45, 46 years old, hasn't had, she's had horrible periods for her life, but not excessively bad. They start to get excessively bad. She gets an ultrasound. She has fibroids. her doctor tells her that she's bleeding from her fibroids and ended up getting a hysterectomy. It's not always, two things can be true at the same time. You can have fibroids and you can have abnormal bleeding. You can remove fibroids and still have abnormal bleeding, because fibroids are not the only factor that can cause you to have abnormal bleeding. So make sure your doctor knows what they're talking about, because there's a lot of people that are getting hysterectomies and a lot of people that are, undergoing procedures and really don't have to have them. Like I said, I just talked to a woman from a consultation literally right before this that, her doctor is pushing her to have a hysterectomy because she has fibroids, but she's not having any abnormal bleeding, doesn't really need a hysterectomy. And that's what I told her. So, it's okay to get a second opinion. It's okay to get, somebody, if you don't feel that you're being told the right thing, it's okay to get a second opinion. There's nothing wrong with that.
All right. I can see questions. I had to press a specific button. What are your thoughts on fibroid teas for shrinking fibroids? Is it worth it?
Nope. One answer. Nope. Save your money. You can give your money to me. Let me tell you something. Tell me what you like. Right? Tell me what you like. What you like? You like crab legs? You like pizza? Whatever you like. I'm gonna put my name on it and I'm gonna sell it to you and tell you that it's gonna shrink your fibroids. And we can look, this would be a good relationship. I promise you, I can sell you whatever you want, whatever you like, I could be able to sell it to you. That is the equivalent of what they're doing, right? There's no magical potion they're gonna put in a tea to make your fibroids get smaller, other than just sucking your money away from you. And if you want that, go right ahead. But I'll tell you right now, I wish somebody would come to my page and argue with me about some damn tea or some herbal remedy or something that they swear is going to shrink fibroids. Because if it was the case, then they just put free game out there. Like, why, give me the herb so I can go take it and help me with my fibroids. Why I got to give you $49.99 so I can drink your tea and shrink my fibroids? If it was free game, if it was, if it was an herb, tell me the herb so I can go get it, mix it up in some water and shrink my fibroids. But they're not going to do that because they can monetize it and they can monetize your ignorance. And don't let people monetize your ignorance. Educate yourself. Don't spend money on things that are not going to work. Don't put false hope into things that are not going to work.
All right. Another question in the video. I was diagnosed with fibroids 2 weeks ago and was given a blood and iron infusion. I'm still dizzy. What could be causing that?
Anemia. Just because you got a blood and iron transfusion. I would think that your blood level after a transfusion should be adequate, but right now, I got a patient that I got to do a consult on when I get off of this live that has a hemoglobin of like 3 point something.
Wow.
If she gets 2 units of blood, she's still gonna be 5 point something. She's still super anemic. So just because you got a blood transfusion, let me give you another teaching point, right? Because people just think that if you just take iron, it'll replenish. Let me tell you the problem with that. So your blood, it takes 3 months for your body to produce one new red blood cell. So for your body to actually produce these red blood cells, it takes 3 whole months. All right. So if you're bleeding excessively and you're taking all of this iron, realize you're losing more blood than you're actually creating. So just because you're taking iron does not mean you're going to be able to catch up, or your body can catch up to the amount of blood you're losing. So just realize that if you're losing too much blood, you're not going to, one, it's going to take long to replenish yourself. But number two, realize that, it's just not, it's a pour in, pour out. Like if I'm pouring into this cup, right, and I'm putting water in here, like at rate X, and then at rate Y it's getting poured out, I'm not going to ever be able to fill this cup up because it's pouring out faster than I can put it in. It's the exact same concept. You're not going to be able to create this blood if you going through 3 boxes of pads every time you bleed, right? You could take iron all day long. You're losing more than you can actually produce.
All right. What are the emotional side effects of menopause?
That's me.
Yeah, I'm not in menopause. Mine is at a halt. No,
yeah, you are in a halt. I don't feel that there's an emotional side effect of menopause. Like for all of the women I see, they enjoy life. Like there's not really like, just this, climactic depression that happens once you stop your periods. Like, and women, I have women that are in their 60s. I have women that are in their 70s that are traveling, that are having pleasurable sex, that are enjoying their lives, like that are doing extremely well. So it's not like this cosmic shift that happens in your attitude and your personality once you go into menopause. It just doesn't. You may have some hot flashes. If you have hot flashes that are so bad that they're impacting your quality of life, you can't be grumpy. You can't have some depression, but therefore you treat the hot flashes and you should be fine. But I don't see women having big issues or mental issues after having menopause. After menopause. At that point, you've had the children that you're going to have, most of the time, you are moving on to your next phase of life and, you enjoy life. But as far as physiologically, there's nothing that should put you in a clinical depression for menopause.
All right. What made you become an OBGYN and not anything else?
So just in a nutshell, I was fascinated with childbirth at a very early age. Like childbirth was fascinating to me. And when I was a kid, like that was the only positive thing on TV was the Cosby Show. So, that was the only positive thing that was around me. I had a bunch of stuff going on in my life that was negative. That was positive. So that kind of implanted the seed when my aunt pushed me to, figure out something other than professional sports to do. I was like, I'll do that. I'll be like Bill Cosby. And then once I saw my brother born when I was like 9 years old, like it was like eye opening. I was really fascinated by that. So, as a young kid, like everything was like just kind of opened up. And then, my mom had a lot of issues. I had a lot of issues in my family. And I just saw it as a way of helping women, right? So I wanted to help women like my mom that didn't have, the greatest of care provided for them. We were in clinics like on public aid and stuff, and I didn't like what I was seeing, like going to clinics and sitting there for 3-4 hours and, people kind of shuffle you around. So for me, it was a way to be able to address families, not just women, but, the kids were coming into, the office or what have you. It was like a way to really, really, really address the family. And in addition to that, women's health, once I got older, I realized that like I really liked surgery, and surgery was my thing, because I was really good with my hands. I cut hair like half of my life, well, actually more than half of my life. Like I was a barber in a barbershop before medical school. That's a whole other thing. But I saw that I was really, really good with my hands. And so the gynecologic part of it was intriguing. So it was a way I could help people and help people surgically, doing something that I'm really, really good at, and also just impacting families. So for me, I knew I wanted to do that as a kid. And then when I went through medical school, it was just kind of reinforced. When I looked at everything else, it was like nothing else really fit me and my personality and the things that I wanted to do.
All right. So I think I got everything that was in the comments that I could see. I think I got the messages that was coming to me directly as well. I may have missed some because Instagram is doing this little...
Yeah, Instagram also.
Yeah, it's on some filtration type stuff on us tonight.
It's tripping.
It's really tripping. But like I said, I always do appreciate you giving time back or giving your time to us as women, our women too. because sometimes we get overlooked and we don't get our questions answered. We'll definitely do it again because I'm sure people will send me stuff or they may have missed. And like he said, you can comment. He's going to post it. I will post it. And we'll do another one. As soon as I have enough questions, we'll set it up.
I'm down like 4 flats.
As long as we keep getting good feedback.
As long as it's helping people, I'm always about helping people. I don't ever want to be corny. Like the day I start being corny about stuff is the day I stop doing it. So as long as it's helping people and people are listening, because like I promise you, like when I get in these spaces, I'm literally like, your brother, your cousin or something, like telling you like, nah, this is how it really is. Like I was just talking to like a rep today. It was like, man, I go into some of these surgeries, and I see like horrible surgeons. Like I see bad things, and I'll see, our people really gravitating to like these certain individuals without doing their research, and just because they, may have seen something or somebody else may have said something, and not truly doing your research and not understanding that, like once you sleep and you go under that knife, like, man, you really, 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 trust me, have to trust that person has your best interest at heart and is going to do for you like they would do their own mama. Like she was just telling you, like, I could have threw the towel in. Like she had a 5-pound, 7-ounce uterus and fibroids. Like literally, she delivered a baby without delivering a baby. She was asleep, so she couldn't even help me push. I had to get that out on my own.
I was sleep.
She was knocked out. So all of the pulling, tugging, bruising was me beating her up to get this damn thing out. So she literally had a baby without pushing. And for somebody to do that, like I nobody else is going to do that. But I did that because I really cared about her as a person, right? When she came in and talked to me or what have you, I grew an affinity to her as a person. So thus, nothing else really mattered except getting the job or getting what I promised her done. And like she said, like, people say, oh, you get paid all this money. No, I don't. All right. I do a lot of other things. I'm a hustler by nature. This stuff that I do as far as like, for women's health, it does not pad my kids' college fund pockets. Like it's other stuff that I do. So for this, I was in there 5.5 hours because of her, and insurances, they don't care if I'm in there 30 minutes or I'm in there 5 hours. They don't care. They're going to pay probably about 25 to 30% of what the charge is going to be, depending on insurance, and that's good. Some of these insurance, they give you like 10% of what you charge, and just be like, go ahead and beat it. And they can do that because they're just insurance companies and they're crooked. But with that being said, you want to have, a person that is not going to put you under a knife or do anything for $1. All right, you want to have somebody that is doing this for all of the right reasons, has good intentions, and wants to see you win, and wants to see you healthy, and wants to see you succeed more than anything else. And it has absolutely nothing to do with money. And how do you do that? Man, I'm just telling y'all, like I say it all the time. Social media is a very, very powerful tool, right? Our ancestors and our people, they didn't have social media 50 years ago, 60 years ago, or what have you. You just really have to go with the meet and greet face value, what they tell you. And anybody, as you know, people put on their best foot and their best face when you talk to them for 5 or 10 minutes. And behind you, they could be calling you niggas and all type of everything else. You know what I mean? So it's like, we see that now when you see around Halloween and when all these people get canceled because they didn't put on blackface at a Halloween costume, or a Halloween party that you wasn't privy to seeing them, or saying something crazy on social media in their private groups or in a party that somebody recorded them or videotaped. Like we have all of these tools that are exposing people that you would not know were not great people any other time. But because of we have these tools, you have to be able to use them to see who people really are, right? So if a person says that they really out for you and out for this or whatever, like, and they trying to, promote women's health or whatever, what are they taking their time outside of their schedule to really reach out and try to help people, right? Like, I'm not getting paid a dime for this, so I'm not, all these posts and stuff I'm doing, I'm not, but I do it because I genuinely want to help people, and I want to see, especially our Black women, get better treatment. Like, if you read some of these medical, like the origins of medicines and how we have these surgeries and stuff, and how it's because they held slaves down, right? And didn't even knock them out. They just held them down, like, 4, 5, 6 white men held them down, and they just performed surgeries and stuff on them, right? And then did experiments on them, and did, left them open and left them with holes. And it's brutalization to the umpteenth. And that's how we have modern medicine and modern gynecology. I don't want, for me, that burns my soul. That should not be happening. But unfortunately, it's still happening today. I said, like, I just posted a woman that just had this big, huge vertical incision, from a myomectomy that she didn't need to have. I see it all the time. And my aim is to stop that or to improve that. But if the doctor that you with does not have that same energy and that same passion, you need to find one that does. They're out here. They are few and far between, but they out here. Study social media, ask questions. I was sitting there in the office for an hour with you, so you comfortable. Ask personal questions. Ask, like, if you was if you were their mama or their auntie or sister or whatever, how would they treat you or whatever? Or, like, have you ever treated anybody that, was like this or like that or what? Like, ask real personal questions. And if they are upset about it, or if they are taken back by it, then chances are they are not for your best interest. Just do your research, please, people.
Yeah. Because bedside manner does make a difference, because you can tell when somebody is just like, okay, anything else? I got to get to the next. Like, you can definitely tell the difference. And absolutely. I definitely felt like I could talk to you like I was talking to my father, my brother, whatever. You definitely wasn't rushing me like, dang, you another question? Right. I ain't know it wasn't like that. So,
but that's how it's supposed to be. And all y'all is like in the office, like, oh my God, I'm waiting. I can't believe what he doing. Because stop that. That pisses me off too. Because if I'm giving somebody my time and making sure they're comfortable and making sure that they're not being microwaved and rushed out, you're going to want that same treatment. So if I'm going to give them my time or what have you, and it makes you late, or it makes me late to come and talk to you, realize I'm going to give you that same courtesy. All right. So, if your doctor is rushing people and just for the sake of being on time and to get your 15 minutes and get more patients and get the dollar, realize that's not good for anybody at the end of the day.
Right. Yeah.
But the pockets. It's good. It's good for a doctor's pockets. It ain't good for you. Correct.
Right. And you even drew me diagrams. Even though I didn't go to medical school, you made it ABC 1, 2, 3.
Absolutely. I want you to be 100% comfortable. Like, once you leave me, nobody should ever say, he ain't really explained that to me. Or, like, I ain't really understand it. Nah, you just either on the slow bus or, like, something wrong. If you leave my office and there's a problem and you still don't understand, it's like, you're just not getting it. Because I will explain it to you and break it down to you until you feel comfortable. I want you to feel completely comfortable. Everybody should do that.
Somebody said in the questions, because I know we got an hour time limit, did we already talk about fibroids and orgasms? So I don't know if that means before or after.
Yeah. So fibroids can prevent orgasms if they're causing you pain during intercourse or pain. Then you can't climax if you having pain. Pain is the anti for orgasm. So if pain is the problem and it's caused by fibroids, then no. But just going back to the other question, if you remove fibroids and you remove the uterus or you remove whatever is causing you to have pain, you should be able to climax without problems. If you're not, then that's a whole nother conversation that I'm good at, that I can, talk to you about. But, it's just, it just really depends on the problem. You always fix the obvious problem first, and then you worry about, the other problems after that. You got to do one at a time. You can't do it all.
And you definitely have to have conversations with your gynecologist.
Absolutely. Be open and honest, and be free to, speak your mind and talk.
All right. Well, since we at the top of the hour, I will go ahead and close it out today. But like I said, thank you for your time. Thank you for dropping gems. Thank you for always helping a woman, our women, and our people. And thank you for the little car monologues. Like, most of my messages said they like this and they like the car. So maybe one day I'll be in the car, because I thought that was the agreement in the beginning. We could do that TikTok with Tiffany Haddish, where she'd be like, "Oh, this is nice."
Man, keep it coming, man. Like for real, I need to hear. Like, people come up to me, it's like, man, keep doing what you're doing. It's helpful, whatever. That helps me, because I'm self-conscious about a lot of stuff, man. If I can't be whack. I can't, if I'm being corny or whatever, I want to be told about it, because I want to stop. So if I'm doing something that just seems corny, people tell me, and that's really genuine. Haters I don't listen to. It's really people that I know are going to be genuine. The trollers, y'all know I got energy for y'all, but for people that are really genuine, and will tell me, pull me by the side and be like, I don't really like when you do that, or what have you. That helps me. That really helps. Or I like when you do that, keep it going. That also helps too. So
yeah. All right. Well, we're gonna keep it going, and thank you for your time tonight. And
so we'll post this one. We'll post this one, and hopefully Instagram will actually let us hit a volume this time. That volume just popped on the other one.
Yeah, it did end up, because I saw the views kept going up, and I was like,
yeah, it came up. And it came up, and that was a really good one too. If people watched it, it was good.
Yeah,
it was good. I looked at it. We talked about a lot of stuff.
Yeah, so definitely appreciate you. We definitely have to do this again.
Absolutely.
All right,
people.
Well, you have a good night.
Absolutely. All right.